Botched, tell me how it works.
So a patient who's had plastic surgery and has had a disaster complication, most of the time some other plastic surgeons have tried to fix it, it's gotten even worse, they're hopeless, they come to us, present their story, and we try to help them. And it's a real challenge. We don't accept all patients because some of the patients have very unrealistic expectations, but for the most parts, we put ourselves and the patients at great risk to try to help them.
And on the spot.
On the spot.
You know, but part two of that is that we have patients that come in that want us to do something absolutely crazy. And what we do is we sit and discuss with them why we won't do that. So we educate everyone watching the show of why this is not a good idea and what are the risks with having that procedure.
Why is it called plastic surgery?
It goes back to a time in the 1600s when plastic surgery was really all about pure reconstructive surgery. It was about fixing missing parts, essentially. Back then, punishments would be, for example, cutting off someone's nose, or there are war injuries, and it's based on the word, a Greek word called plastikos, which is to change form. So the original operations really were very interesting, very significant. Some of them we actually still do, but one of the original operations was to make someone a nose, you would make a tube from their arm skin, and they'd walk around like this for a number of weeks, get blood supply, and then you would detach it.
What's the most common botch?
Since the number one procedure that plastic surgeons perform is breast augmentation, it's going to be revision of breast work, especially because you're putting a foreign body, a breast implant into the body. Now, I'm a facial plastic surgeon, so what I do is I do the number one thing for me. About 25% of someone who has a rhinoplasty, a nose job, need to come back and have some type of a touch-up, whether it's minimal or very severe touch-up. So I do a lot of these revision rhinoplasties.
What do you specialize in?
So I do head-to-toe plastic surgery, but he's so good at the facial procedures on Botched, I do most of the body stuff. So I'm the one who does the breast augmentation revisions.
Does Botched contain shows where you couldn't fix them?
Oh, yes. I mean, it was interesting. We were talking about this last week when we were in New York. When we first started the show, we had 500 people cast for it. And when we look at some of the patients before to say, can you fix this? It was usually no, 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 yes. But throughout the years, we've been so lucky that our talents have been increasing because of complexity. Now it's usually, after 10,000 people that will cast for the show, it's usually yes, 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 no. But when we do these cases, especially this year, they're getting harder where some of the cases have to actually fall apart, which he's had a lot of them this season, and then he has to reconstruct them again.
The people you take for the show, I presume, because they're coming on, they get it for free?
They do get it for free. That's sort of their appearance fee, is to have free plastic surgery. But they do it at great sacrifice. They come in here for many months, and particularly this season, season 6, as Paul was saying, these cases are so hard that we sometimes have to do 3, 4, or 5 operations on them to get them back to normal.
Okay, there's so much devoted to this show. What about your private practice?
One thing we both do is we're both workaholics. This guy actually sometimes will work 7 days a week. I try to stick it at 5. And the other time that we're not filming, we're either seeing patients or operating all the time. That's what we do.
But our practices are Botch practices. I mean, Botch is on in 160 countries throughout the world.
Wow.
So when you come to Paul or I, you're coming to us because you've had a disaster. 85% of my practice is out of the state, and 50% of those are out of country.
Whose idea was to do the show?
We were sitting down because the same producers did The Housewives. Beverly Hills, I was on that originally, and that's when I first met you years ago, and then he was on the Orange County. So we were sitting down after I was not on the Housewives show anymore, you know, my ex-wife and I. And I sat down, I said, you know, we got to do a surgery, and one of the producers of trying to fix people that have had destroyed surgery, but do it on TV.
Well, that's what we specialized in anyway.
And
I get it.
And so I called him, and he goes, what are you, nuts? We're going to fix these cases on TV, and what about the complications? I said, so what? And he goes, well, let's give it a shot.
It's a really bad idea, isn't it?
Do you show the surgery?
Oh, we show it.
Well, pieces of it.
We show it. They blur out some of the more graphic parts. We don't show areolas, we don't show sensitive parts of the body, but it's pretty graphic. But when you see it in other parts of the world, they show a lot more.
Yeah.
Co-hosts of Botched in America, right?
Here, it's all over the country. We're the same doctors. They just dub different
Oh,
voices to us.
Yeah.
Did you do a lot of reconstructions before this show?
Oh, yes. I mean, we both are reconstruction specialists. This is now like what Terry was saying. Let's say we used to do 50% of revision work, which means fixing something. Now we do about 80 to 85%. Now, the rest of it, of course, is someone comes in, first time wants a facelift or a tummy tuck or a breast augmentation or their eyes done. We, of course, do that because we're experts in the field.
Is it common for doctors to botch plastic surgery?
Ooh, that's a good question.
It's a great question. We actually didn't like the name Botched initially.
Great name.
It is. It was actually called Nip-Effed, if you know what I mean. Initially, that was the working title. When they changed it to Botched, because the advertisers didn't like Nip-Effed, we didn't like it initially because it implied that the doctors did something wrong. And that isn't really the case. Plastic surgery is as serious as any other type of surgery, heart surgery, cancer surgery, and it has complications that naturally occur even when you do it perfectly. So, we didn't really like the name Botched. So it's a very serious game, surgery is, and it comes with complications.
So some doctors screw it up. Some doctors are not board certified and they're playing with this type of surgery. Maybe take a course for a weekend and do the breast augmentation. Some doctors are excellent and have complications. And that's what happens with all surgery.
How do I know what doctor to pick?
That's a good point. And in general, you always want to go to a doctor who's trained in the procedure that you're going to do. The only way you can find that out is if they're board certified in that specialty. In Paul's case, it's the American Board of Facial, Plastic, and Reconstructive Surgery. In my case, the American Board of Plastic Surgery. I recommend any other board certification is not real. It's not part of the American medical specialties of board certification.
What's the number 1 plastic surgery procedure? Breast?
Breast augmentation.
And 2, it's lipo.
2 is liposuction.
3, it's rhinoplasty, nose jobs.
What percentage men and women?
Okay. I would say, I'm going to shoot this one. I'm going to say, well, for face work, I'm going to say 80%, 75% women.
Yeah.
The rest men.
Yeah, obviously breast augmentation, except for Paul, it's 100%.
All right, what do you make of social media putting a different kind of pressure on people? They're forcing them to look better, bringing more business to you. What's the effect of Instagram and all the rest on you?
You know, it was interesting. I remember 3 years ago when doctors were starting doing before and afters on social media, for example. And I did that also, as a matter of fact. And I started using that as a way to show some of my before and afters. But in a way now what we're seeing is something that we both coined the term selfie dysmorphia, where patients are taking social media and filtering themselves so much, and now you recently have seen Instagram is actually trying to get rid of some of their filters because they're looking at patients now and they're changing their self-image so much that it's affecting them. And what we're doing is we're seeing some of these patients come in with these very filtered, non-realistic expectations on what they've done. And it's unhealthy. So we look at these patients, we say, listen, this is not realistic. You're not going to get this. And then what happens is this can cause a buildup of anxiety, of being insecure, all kinds of problems. So it's a little dangerous.
Instagram, good or bad for business?
I think, unfortunately, it's good for plastic surgery business, but it sends the wrong message because there's this expression, FOMO, fear of missing out. I think people look so good in their filters that when you see them, you think, well, I don't look that good. So you start filtering your own pictures, and then you get anxiety because you actually don't look that good in real life. So you say, boy, I better go to a plastic surgeon and get these looks.
Selfies. Have people doing selfies and coming in, right?
They are. They're taking selfies and they're putting filters on them and then presenting them to the plastic surgeon saying, I need to look like this because this is what people think I look like.
It's my new persona.
It's my new persona. And so that's what's driving business to a plastic surgeon's office. This look that the created look that they have.
Because of this attention on looks.
Yes.
Do you see many people coming who don't need to come? I mean, frankly, I'd like to pinch the ear back. You're crazy.
Yeah, we have a lot of, we'd probably say about 10% of our patients that walk in our office, you might have a different number, come in that don't need what they think. Now, either one, because they're something called body dysmorphic disorder, where they feel that they need to have something done because it looks really bad, but it doesn't. Matter of fact, I had a patient yesterday who came back. Funny thing you mentioned, one ear stuck out just a little bit more than the other ear. Just a little bit, 2 millimeters. She wanted it done. And I said, I won't be able to do a good job. I won't be able to match it. So I don't think you're a good candidate. It happens all the time.
Do you turn down patients?
I turn them down all the time. In fact, I always say to them, I always start with the negatives. I say, well, how do you feel about scars? A big scar going across your abdomen. Is it really worth a big scar to tighten your abdominal skin just a little bit? I don't think so, and I send them away. But plastic surgeons tend not to do that.
What's the toughest plastic surgery to do?
Nose jobs.
Face.
I mean, it's more the nose.
Why is the nose such a problem? Because the nose.
Nose. Interesting, if you go and have the first time rhinoplasty and you take away a little cartilage from the tip of your nose, it could heal very well, but if you look at those noses from a period of a year to 20 years, something deforms within that nose because of something called three-dimensional healing. It deforms. Now, the second part of what I do is I'll do these noses that have been done 3 times, 10 times. The blood supply to the nose is, we basically say that it's not great anymore. And so I'm at risk of having the skin die many times.
We have all seen people. Every day you run into one or two. You say to yourself, why did she have plastic surgery? She looks terrible. The eyes are now lenten to me. It's a familia facta. Who needs that? I'm inventing my own words, but I can't stand when I see it.
Well, the best plastic surgery is invisible, right? If you can see it, it's bad by definition.
Right.
So plastic surgeons need to have a very light hand, and if they don't, they need to get a light hand, you know?
Do you work on the psyche, the inside of people as well as the outside?
Every patient we work on has to go through a psych evaluation to make sure they're good candidates. And in our practice, we've actually gotten a pretty good radar, a sniff out to see if there's any red flags. So we have to do that all the time, 100% of the time.
Never miss a beat. Subscribe to Larry King now and watch new episodes every day.